So most people treat allergies on an as-needed basis.
Now, when it comes to allergy, what comes in our mind? Skin rashes, skin itchy, nose, sneezing, nasal blockage, or coughing and breathlessness.
Allergy is often the reason why the child is falling sick so often.
Sensitization is like the first step towards allergy.
Dust is everywhere. What can you do about it? So just live with it.
Doctor, can we be allergic to something which we were not earlier?
As the child grows big, the child may get allergic rhinitis or allergic asthma.
Live with your problem is something that could have been said in the 70s and 80s when we didn't know much about allergies, but in 2024.
Hello everyone, I'm Ikta Verma and welcome to the Allergy Insight Show and your go-to guide for the allergy testing and understanding allergies. And today in this special series, we are with top 3 allergists to understanding the allergy concept. And here they will discuss the causes of allergies, how they are diagnosed and the best ways to handle them. First of all, thank you so much doctors for your precious time, and we have few doubts to clear. That's why we call you here, and it really matters a lot. So doctor, I'm a mother of 2, and you know, when you're a mom, you're so sensitive when it comes to baby. And I'm really worried about my baby's sensitive skin and the allergies. Like, should we get tested every time, or is this big concern, or I'm taking it for granted? I'm really confused. So I have few doubts to clear in my hands. So let's get started. So our today's 3 speakers are here. Dr. Sitesh Roy.
Hi Ekta, thanks for having me here.
Dr. Mangai Sinha.
Hi Ikta, great to be here.
And Dr. Vikram Patra.
Thank you, Ekta, for having us over here.
So doctor, my first question is from you, Dr. Sitesh Roy. People often complain that allergy keeps coming back even when you have completed the course of medication. What can we do to prevent it?
So Ekta, it's a very common problem that we see where a child comes to us where the parents say that the child keeps getting cough, cold, goes to the doctor, takes medicines for sometimes 5 days, 10 days, 15 days, and then gets better, but then recurs the problem after around a week, 2 weeks or a month. And in such situations, it becomes very important that the doctors and the parents think about allergies in such cases, because the allergy is often the reason why the child is falling sick so often. You know, there are guidelines for this where they say that if you have more than 3 episodes of wheezing and cough, or you have colds more than 5 or 6 times a year, that you should be suspecting allergies and doing investigations for this. And that really is the main thing for parents to look out for, that they should be having this high level of suspicion that if my child is getting sick too often and every time gets better but then relapses, think allergies.
So doctor, can we give home remedies to kids, or we should get tested first?
So I think that in the first few episodes, if you're taking your local doctors or pediatricians' care, you're doing some home remedies, these are perfectly justified. But when the episodes keep happening, they keep recurring, as I said, somewhere between 3 to 6 episodes is kind of the cutoff. And then you really need to start thinking we need to do more than just home remedies or antibiotics or cough syrups or, you know, cold medications, because that's the usual story, and allergies keep getting missed sometimes for months and years in such cases.
Doctor, can we be allergic to something which we were not earlier?
Yes, definitely. There are many times that we see that we may have had something, or for example a food. We may have eaten the same food for years and nothing would have happened. And then suddenly one fine day you start showing up some reactions to that. At that time we really have to think about allergy. Just like Dr. Roy just said, that we need to have a high level of suspicion. We need to be alert and aware. Many times we see our patients telling us, "Nahi, मैं तो बहुत पहले से खाता था, मुझे तो कुछ नहीं होता था." Say for example prawns. I've had prawns all my life. But now if the patient has started developing some reaction, then we have to really think of allergy.
So doctor,
yes.
Is there any specific age where you can get it, or any age?
No, we can get it at any age. Allergy is more so dependent on the immune system and also on the environment and other factors like stress and all. So it just is how your body reacts to that substance. So you can get it at any age, even at late adulthood, many times you can get that.
Thank you, doctor, for the valuable information. So my next question is for Dr. Vikram Patra. How to spot fake allergy test?
Thank you, Ekta, for bringing this question. Basically, when you look for allergy test, and if you are not consulting with your doctor or allergy specialist, you may encounter various tests available online. So most of them, they say they are allergy tests, but they are not. Mostly they have food intolerance test, and we need to understand allergy and intolerance are two different things. And they go for comprehensive panel where they go for the test which is based on IgG. Basically allergies are IgE mediated, and we are not interested in IgG. Those tests, they are just telling you that you are just exposed to that food item. That doesn't mean that you are allergic to that food item or you are intolerant to that food item. So we should avoid those tests. We should not go directly, and you should not waste your hard earned money in those tests. One more test which is going up is the hair test. Hairs are good for sampling heavy metals, but nothing to do with allergy test. No scientific evidence for even hair test.
Can we spot, doctor, if it's fake or not?
Just look, better to consult because they will be very attractive online. So if it is mentioned IgG or food intolerance test, so food intolerance test is not for allergies.
Dr. Sitesh, we have a question for you. What is the difference between allergy and hypersensitivity?
So, Ekta, in terms of allergy, as was mentioned by Dr. Patra, the antibody that is involved, so we have variety of different antibodies that has been given to us by nature to fight viruses, bacteria, parasites, even internally if cancer cells are being formed. And one of these type of antibodies is something called IgE. When we make this IgE towards something that's very innocuous, like maybe cow's milk or towards wheat or towards a house dust mite, that's a classic allergic reaction which occurs within minutes to hours after exposure and can give you a wide variety of symptoms depending on which organ system is involved. So allergy is more of an immediate hypersensitivity. When we talk about hypersensitivity per se, that kind of a reaction is mediated more by something called IgG, which is another type of antibody, and immune complexes. And these reactions tend to be slower. They don't occur immediately. They may occur hours or days after exposure. And a very classic example is hypersensitivity to pigeon feathers and pigeon droppings, which has become a huge issue in some of the metro cities. And these type of reactions are not classic allergies. They will not be detected on a skin test or on a blood test, and they require a whole different type of evaluation to be able to detect that kind of a hypersensitivity. So there is a world of difference between both, and people confuse between both, even tests confuse between both.
So doctor, suppose I'm traveling and I know I have some kind of allergies on my skin or my baby's skin, and I don't have time for testing and anything, and I take some time. So it can be like fast, or it will be fine after some time, or I can take test, I can take my time.
You can take your time. See, allergies, once they occur, your initial response is to control the symptoms. That's your priority. So if it's a skin rash, using maybe a cream or an emollient. If it's a respiratory problem, then taking the right antihistamines or other medications. Once the problem is settled is when you should be seeing your doctor or an allergist preferably, and they need to get very deeply into your kind of exposures, timing of the reaction, and then decide the best line of evaluation or testing for you. So it's not an emergency, but it requires timely action.
Thank you so much, doctor. So do allergies go away with age?
Yes, some of them are very lucky that their allergies do go away with age. Like for example, the most common example is if your child is allergic to milk, then 90 to 95% of these children outgrow milk allergy by the time they reach 4 to 5 years. But if you are allergic to peanuts or tree nuts like the cashew nuts or walnuts, even fish, these allergies persist throughout life.
So I am cat allergic, and it happened when I was pregnant with my second baby. So is there something like I should cover up, or I should be okay, or I should stay away from the cats?
The first step for allergy that we do is avoidance. So avoiding what you're allergic to, that is the first line of management that we all allergists follow.
And we do this mistake only. Thank you, doctor. So doctor, too many pricks scares me. And how do we check for allergy?
So particularly when it comes to skin prick test, no, basically our purpose is to detect IgE antibodies in the blood. So if someone is allergic, IgE antibodies are there, so we have to detect. So we have two methods. One is skin prick test. The another common method is going for a blood test. So now skin prick test, if parents are apprehensive, particularly when we are dealing with children with allergies, they are a little hesitant for going multiple pricks. Though we do only 15 to 20 pricks, depending on the history, but still some parents may not agree. So in such patients, we have blood test where we can go for the specific antibodies against a specific allergen.
Thank you so much, doctor. Doctor, we have a question. I think it's for me. Are allergies really a problem? Because patients are often told by doctors that you just have to live with it.
So this is a story that we hear all the time, Ekta. We get parents who have had or have even asked their pediatrician or their family doctor that does my child have allergies, and they say even if they have allergies, let's say to dust is everywhere, what can you do about it? So just live with it. When your child has problems, take medications. But this is not the approach that we as allergists believe need to be taken, because even a simple allergen like house dust mite, if it is detected through an allergy skin test or a specific IgE blood test, if you do allergen avoidance appropriately in that child's bed, you can cut down the child's symptoms by up to 50% just by the right allergen avoidance. Now with it, if you do the right medications, the child can be 100% better. And over time, once you detect what the trigger is by the right testing, you can do something called allergen immunotherapy, which can completely desensitize that child or that adult from that allergen. So I think that just saying that live with your problem is something that could have been said in the 70s and 80s when we didn't know much about allergies, but in 2024, to say that is completely inappropriate.
True. Thank you so much, doctor. It's a big relief. So, doctor, can allergy be the precursor of asthma?
Well, yes, many times allergies are precursors to asthma, generally adult onset asthmas, not the childhood. Childhood asthmas or childhood wheezing may have many causes, allergy or maybe one of them. But like we have something called as the allergic march, where it begins with allergic skin or the atopic dermatitis that we call in our words, in our scientific words. And then as the child grows big, the child may get allergic rhinitis or allergic asthma as the child grows big. So as much as high as 60 to 60% of patients or children who have had severe atopic dermatitis or an allergic skin in childhood can develop asthma when they grow big. Similarly is with allergic rhinitis, all the children who keep coming with a leaky nose, they may also grow up to develop asthma. So we can say that allergic asthma, allergies can be a precursor for the allergic asthma.
So, doctor, sometimes when a person feel breathless at a specific duration of time, suppose in Diwali and specific because of colors, so is it the asthma symptoms or is just because of the...
Yes, so we do have a concept. See, what is allergy? If you have to see an allergic asthma is when your lungs become sensitized or they hyper react to a particular trigger or an irritant or an allergen. So when they hyper react, they constrict, they go into spasm. That is when you develop these breathlessness. You may be allergic to dust mite all through the year. So you may have some mild symptoms, but during these times, Diwali times, when the pollution increases, when the irritant, the smoke in the air increases, the threshold increases. So the child may start having severe symptoms at that particular time.
Thank you so much, doctor. So, doctor, can allergy present with unusual symptoms?
This is a tricky situation actually. Now, when it comes to allergy, what comes in our mind? Skin rashes, skin itchy,
True.
nose, sneezing, nasal blockage, or coughing and breathlessness, right?
Yeah.
But there are many more symptoms which can point towards underlying allergies. So one of them, a person who is having recurrent headache, having loss of smell, snoring in the night time, disturbed sleep leading to daytime tiredness or daytime sleepiness, we should think of allergic rhinitis or allergic nasal symptoms. Sometimes they can have itchy eyes, watery eyes, tingling sensation of mouth, lip, throat. So these are also allergy conditions. Particularly in kids, if they present with recurrent abdominal pain or constipation, loose stools, any altered bowel, vomiting. So again, these are the symptoms which can point towards some underlying allergy to some of the allergen.
So doctors, these small things, when a mother see all these things, you are having stomach problem or you have a tickling in your throat or runny nose, they either they do home remedy or they visit to doctor for random, medication thing, that's all. So we should go for the tested or not?
So first, your primary person who is going to deal with this condition is the pediatrician or a family physician. So when in allergy, it won't be a single episode, you will get recurrent episodes. So when this is happening recurrently, then the physician or the pediatrician will think of allergic and he will advise allergy test, or he may refer to an allergist. So there they will go for. I'll suggest don't go directly for any test, better to have consultation with your pediatrician or physician.
So we have a question, doctor. How will an allergy test help in patients who suffer quite frequently?
So Ekta, what happens with patients who have recurrent allergic symptoms, let's say they have eye allergies or nasal allergies, or they have allergic asthma, or they have skin allergies, is that medications can control the symptoms, but they can't take care of the root cause of the problem, which is an aberrant or an abnormal immune response to that substance. So when an allergy test is done, we are first identifying the offending triggers. When we identify the offending triggers, we now give that parent or that child or that adult a chance to avoid those allergens. So allergy testing helps with avoidance. If it's a food, it becomes something that can even protect them from anaphylaxis, which is a life-threatening allergy that can occur with that food. So allergy testing can help us identify that. The second thing that happens with allergy testing is, as I mentioned, you can now think of desensitizing a person from that allergen. So very effective allergen immunotherapy is available for house dust mite allergies, for grass pollen allergies, tree pollen allergies, animal dander allergies. You were mentioning about cat allergy earlier. If someone gave you cat allergen immunotherapy, you could then be around cats potentially. So it's only when you do the testing and recognize what your allergies are, can you actually take action with avoidance and take action with desensitizing yourself or protecting yourself from the exposure to those substances.
After all these medications, suppose doctor, if I'm on medication and I think it's just about a day, let's have that, whatever the allergy I have, and we skip the medication and we take one or day two. So is it okay? Is it safe for us?
So medications, so most people treat allergies on an as needed basis. They consider that, when I have symptoms, I'll take my nasal sprays or my inhalers or my tablets, and when I don't have it, I won't take it. This is okay if you have very mild disease, because disease has to be classified, it has to be categorized. So in very mild disease, intermittent therapy is acceptable, but when you have a persistent disease, one that keeps recurring, keeps relapsing, keeps happening, we analyze the frequency of the symptoms, the intensity of the symptoms, and the problem that the person is having to decide whether intermittent therapy is right for them or not. And for anyone having persistent symptoms, it is not okay to just take medicines when the symptoms get worse and ignore the minor symptoms when they are occurring. That's what people learn to do. They learn to live with a little blocked nose in the morning, a few sneezes in the morning, a little scratchy throat here and there. They say that, we can live with these things, but that's not okay. They need to be evaluated and treated. There are excellent therapies available now for these things.
We do, especially our parents do this thing. Thank you, doctor. Doctor, what is the difference between allergy and sensitization?
So Ekta, sensitization we can say is like the first step towards allergy. So suppose you're allergic to peanut. So when you first take peanut, the immune system identifies, for some reason the immune system of some people identifies that peanut, which is actually a harmful substance, as a threat and starts developing antibodies. So like was said previously, there is a lot of production of IgE antibodies. Now these antibodies, then they go and they get attached to cells which are called as the mast cells. So this stage is called sensitization. Now on second exposure, so suppose you are having the peanut for the second time, that time these the allergen, the body again identifies, oh, that this is the peanut, this is something harmful, and at that time the allergen goes and gets attached to the IgE antibodies which are there over the mast cells, the step which occurred in sensitization, and that leads to breaking up of these cells, the mast cells, which releases a lot of chemical mediators, we call them. Most common of it is histamine. Most of you all have heard of histamine, which then causes the symptoms. So then, which will then cause the itching or the wheezing, breathlessness, so the symptoms. So when you develop symptoms to a particular allergen, that is the allergic reaction. Sensitization, you may just be sensitized, but there will be no reaction, the body will not show any reaction.
So doctor, these small minor allergies which we avoid, you mean we should not avoid? Like we think that we have itchiness, it will go in a day
Yes.
or two, we should not avoid, right?
Yes, because those may be mild symptoms which at
True.
any point of time may just throw a anaphylaxis. So suppose you have peanut right now, you may just develop some those hives that we call, the red patches, which disappears the moment you take an antihistamine, or which disappears after you apply some Calidral lotion initially. But maybe few years down the lane, you may just throw up an anaphylactic which can be life-threatening. So you should not ignore.
Thank you so much, doctor, for saving my life. Dr. Vikram, can we get tested for allergy if already taking medicine?
Basically, allergy is a dynamic disease and a progressive disease. So basically, when it comes to the treatment, we have two modalities. We can have good control on allergies, and our permanent treatment will be cure of allergies. So by taking medications like antihistamine as mentioned, they will just control your disease. But once you stop your medications, the symptoms are going to come back again and again. So testing for allergens so that you can go for avoidance or you can go for desensitization is the mainstay of treatment. So now the situation is like that, if the symptoms are mild, medicines can be stopped for few days and we can go for skin prick test. Skin prick test to detect the allergen to what the person is allergic to. But there are certain conditions, severe itching, say, or severe sneezing, the person cannot stop the medication, then we have blood test. So on treatment with antihistamines or even on medications, one can go for allergy detection by doing blood test. Blood test, that means serum specific antibodies, IgE antibodies against few allergens.
So doctor, again I have a question. So I have thyroid and I'm taking 150 mg suppose, and I'm taking another medication which is for my allergy. So I have suppose itchiness or something. So if I am stopping by myself, thyroid's not good, so shall I ask to doctor, or I can be pause something?
So very relevant questions. A person can be on various medications. Let us consider, if I don't consider thyroid, if I consider only allergy, a person may be taking inhalers for asthma control, must be taking some intranasal or nasal sprays, and must be taking some antihistaminic tablets or anti-allergic tablets. So for doing skin test, we need to stop only anti-allergic medications, and few other medications are there. But thyroid medication need not be stopped, and same is true for many medicines which need not be stopped before doing skin prick test.
Okay doctor, thank you so much. Doctor, are all blood tests for allergies out there accurate and reliable?
Unfortunately, Ekta, the answer is no. There are a lot of what I would call spurious or antiquated blood tests that are still being done in our country, where they are being run on a system of testing which is called RAST. And in the RAST testing, there can be a lot of what we call false positives and false negatives that can occur with the testing. So over time, the allergy testing has evolved over almost 100 years. And today we have extremely accurate tests which is called specific IgE detection, and a step beyond that which is called molecular allergen detection. where we can not only look at the specific allergen but also subcomponents of that allergen. And so when you are doing an allergy blood test especially, it's very important to know what the test is, where it is being done, whether the system that the test is following is the latest system or an old or antiquated system, because many of these old systems that are being followed are cheaper but they don't give you very accurate results, and then the child or the adult is avoiding a bunch of things because 5, 10, 15 things have come positive on the test, and those are not relevant clinically for that child or for that adult. So there are a lot of erroneous tests, and visiting an allergy specialist is probably your best bet at getting an accurate test done.
So doctor, when we go for the test part, shall we keep a gap for second testing thing, or we should wait for the doctor?
So I think that what you're trying to ask me, if I'm understanding correctly, is that should a patient directly go for a test, or
For
should they
second.
take their doctor's advice
Yeah.
and then go for a test? The best thing to do is always to take a doctor's advice, preferably an allergist's advice, someone who is trained in the field of allergy, understands this disease, and can, because see, the testing is never a direct thing. You need to know the history of the person. So there are a lot of these panels that are available in India now where you can do 50, 100, 200 allergies. And one of the ways you can detect that it's not an accurate test is if it is testing for things like cement allergy or limestone allergy or charcoal allergy. You can't get allergic to these are chemicals. So it's very hard for a patient to detect whether this test is an accurate one or not. So the better thing is to see a specialist, get your history studied very well, examined if there are signs and symptoms on the body, and then let the doctor select the test for you, which is the right test for you.
Thank you so much, doctors, for your valuable time, and thank you for joining us for the Allergy Insight show. We hope our discussions with the medical experts have provided you with valuable information on allergies.
Thank you, Ekta, for having us on your show. We hope that all the responses that we have provided help you and your family in taking better care of yourselves. Thank you.
Thank you so much, and I really hope that our answers help you and all other moms who are out there searching for answers for allergies.
Thank you for having such practical questions. I hope everyone will get benefit from these answers.